Lord Jesus, give me strength. Help me, Lord. Um, so I will be sharing, and I'm gonna keep my video off. I'm not doing that to be disrespectful. Brian knows I'm having computer problems, and so in order to save some energy, I will be keeping my computer off. And let me swap views here. All right, are you all seeing something that says CareBridge?
Yes, ma'am.
Okay. All right. All right. So welcome everyone. Good evening. Brian did see a different presentation on Lord Jesus, Brian. We done had so many meetings this week. I don't know if it was yesterday or the day
Yeah,
prior.
yesterday.
Um, but I did go into CareBridge, and I made this one specifically for IWI and the faith-based community. So thank you all for allowing me, giving me a few minutes to share something we have been developing called CareBridge. As community health workers, we have peer specialists on here, we have pastors and community leaders. We spend our days helping people. We help people find food, transportation, housing, healthcare, recovery support, employment opportunities, and much more. But here's the challenge. While we know we're helping people, we often struggle to answer bigger questions. What needs are increasing in our communities? What barriers keep showing up over and over again? What services are missing? What root causes are driving these problems? And how do we demonstrate our impact as faith-based community to funders and decision makers? CareBridge was designed to help answer those questions. We have stories, and stories matter. But if we want systems change, we need more than stories. We need systems intelligence. So as you see on the screen, what needs are increasing in your community? What barriers keep showing up? What root causes? What evidence can we share with funders? CareBridge is a community intelligence platform. Its purpose is to help communities identify needs, track referrals, monitor outcomes, recognize patterns, identify service gaps, understand root causes, and most importantly, support systems change. Think of CareBridge as a bridge between community encounters and community intelligence. It helps us move from simply documenting problems to understanding what those problems are telling us. CareBridge is not, so I want to be very, very clear. CareBridge is not an electronic health record. I know I got my clinical people on here tonight. It is not a hospital chart, a medical record system. It's not a clinical decision-making tool. And it is not a crisis intervention platform. We are intentionally starting with community intelligence and system understanding, not clinical care management. CareBridge is a platform. It's a community needs assessment tool. It's a referral tracking tool. You're going to hear me say this a lot, and I will explain it more. It's a systems change tool. And it's a community impact dashboard. Our goal is to help communities better understand what they are seeing every day and use that information to drive action. Let me show you how simple the concept is. Step 1, community members share concerns. Those concerns may involve, once again, housing, transportation, employment, food security, healthcare access, recovery support, or other needs. Step 2, the CHW, the community advocate, the peer specialist, the hub leader, the community partner documents that encounter. Step 3, CareBridge tracks the needs, tracks the referrals, outcomes, and trends. Step 4, and don't let this scare you, Beacon AI, artificial intelligence, helps identify patterns, service gaps, emerging needs, and possible root causes. The goal is not to replace people. The goal is to help our people see what the data is teaching us. This is where things become very powerful. One person needing transportation is a story. 10 people needing transportation is a trend. 100 people needing transportation becomes a systems issue. CareBridge helps us recognize when individual stories become community patterns. And once we see patterns, we can begin working on solutions. When we talk about root causes, we're talking about what's underneath the problem. For example, someone may tell us they need employment, but after we ask a few questions, we discover the real barrier is transportation. They cannot get to interviews. They cannot get to work. Now imagine seeing the same pattern across multiple churches, multiple hubs, and multiple counties. Suddenly, we realize the issue isn't employment alone. The issue may be transportation infrastructure. That's how we move from helping one person to understanding an entire community challenge. Beacon AI is the intelligence layer within CareBridge. Beacon AI helps identify those patterns, those trends, those resource gaps, and also the community strengths and emerging concerns. However, Beacon AI does not diagnose, it does not provide treatment, it does not replace CHWs, pastors, healthcare professionals, or community leaders. People must remain at the center of this work. Beacon AI simply helps us see what we might otherwise miss. Imagine being able to tell community leaders and funders, transportation is the #1 barrier in 5 of our counties. Food insecurity increased significantly over the past 6 months. Healthcare access challenges are concentrated in 65270. Housing concerns are increasing in St. Joe among older adults. Those kind of insights help us move from assumptions to evidence, and evidence leads to better decisions, better partnerships, and stronger communities. This is why I believe CareBridge aligns so well with inclusive wellness. We already have the hubs. We already have sub-hubs. We have community health workers, community health advocates in our churches, pastors, and community partners. The relationship already exists. The trust already exists. CareBridge helps us understand what those relationships are teaching us about the communities we serve. For this pilot phase, our focus is intentionally simple. We want to track community needs, referral activity, resource connection, service gaps, and community trends. At the same time, we want to be thoughtful about privacy, confidentiality, and responsible data collection. This pilot is about learning together and building a strong foundation. At the end of this pilot, I hope we can answer questions like, what are the most common needs across our communities? Which referrals are working? Which barriers remain unresolved? What resources are missing? And what root causes require system-level solutions? If we can answer those questions, we have something incredibly valuable for communities, organizations, and funders. Tonight, I'm not asking anyone to purchase software. I'm not asking for a financial commitment. I am asking for a few hubs that are willing to become a pilot partner. We are looking for approximately 3 to 5 hubs that want to help us test the platform so Brian and I can improve the workflow, identify meaningful data points, and help build a community owned by intelligence system. This is an opportunity to shape something that could eventually benefit communities throughout Missouri. For years, our churches, our CHWs, our peers, and our community organizations have been doing extraordinary work. CareBridge is not replacing that work. It's helping us to understand that work, measure that work, and use the knowledge to identify those root causes, which in turn will strengthen our communities. So, I'm going to say it one more time. The flow for the churches is to see needs, log community members' encounters, and identify what's blocking them. If you make any referrals, connect people and document those warm handoffs. When multiple people face the same barrier, the system will automatically flag those patterns. Now, I'm going to stop sharing for a minute because I want to share the actual CareBridge with you. But if there's any questions or comments, I'll be willing to take them at this time. I don't want to scare nobody out. So if you got any questions or comments, I'm here to take them. Or Brian can start talking while I'm pulling up CareBridge if you choose to.
Yeah, questions? Go ahead. Someone have a question, or is that my echo coming back? So in this work, I always, and I've taught this and I've said this to people, been using AI all my life, the authentic intelligence of the Holy Spirit. It's got to be first, and it is first. But we're in an age now that, and I'm sharing this, I'm teaching staff, too often all we deal with is information. Information. We never move a lot from beyond information to insight, to intel, to intelligence, so that we can become the intellectuals at the table. Here's what's happened to our communities, and we bought into this for years because I was working with a group, and this is what they do. It's called participatory evaluation. Let's go into this poor Black community. Let's find a church to work with. We'll give that church some money to help us do this, to recruit, help us bring in people. We're going to get data from the Black community, and we're going to write up our own white paper, and we're going to get funding for research, and then we're going to give them a $25 gift card for giving us all their information. And in a lot of cases, we're not even going to give their information back to them. We're going to take that information and move it forward. And this is what the university taught me about participatory evaluation. And that's what was happening to a lot of our Black communities. The researchers was coming in, giving us crumbs from the table. We accepted the crumbs in a lot of cases, thinking that we got something. And they never even brought the information back to us. They went forward with the information, wrote up research projects, wrote up white papers and all this stuff. And we were left with, okay, what's next? What's going to change in our community? You came in, you wrote off we still look the same. If it's going to change, we're going to have to be the agents of those change. We're going to have to say, we now have the tools and devices to do this for ourselves. And this is what a part of this community intelligence. There is another AI that is prevalent. I've been hearing my pastor that I talk about it. We have ancestral intelligence. We have connect our churches, as I said before, most of our churches represented have been around for 100, 150 years. We have ancestral intelligence in our churches that we rarely tap into, that we've got to tap into that intelligence and utilize that intelligence and put all this together so that as my grandson who just ran around, my whole impetus for a lot of this is I don't want you to know diabetes. I don't want you to know high blood pressure and all the way that we know it. But if we don't step up to the plate and do something about it, it's just going to become a continual generational cycle of addictive failure for us, generation after generation. The outcomes are not going to get better. They're not going to come in and do it for us. They'll come in and get our information, get their research. Because I was working with the university, and the professor was like, you know what? We get projects anywhere from $20 to $40 million doing research. And a lot of the data is driven by the poor communities. How much of that 20 to 40 million goes back into those communities to even put a program for change? A lot of times they're like, that don't even happen. It's just the research part. So guess what? We can do our own research now. In the words of James Brown, don't need nobody to give me nothing. Open up the door, I'll get it for myself. We're at a place now we can get it for ourselves if we would be willing to put in the work, and we can become the agents of change. So this whole thing, as Lauren says, is not meant to scare. It's just that we got tools now that can even out the playing field for us, and we can do a lot of this for our own selves if we put forth the effort and use the tools. So Lauren, I think you're going to show the platform. Is that correctly? That
Yes,
got
that is
created
correct.
from scratch. From scratch. This didn't come because we have worked in this type of stuff for the last several years, and we have been in. And this is what other people have had access to, types of stuff like this, and that's why they're so far ahead of us. We never had access because when we tried to look into some platforms, what Lauren a few years ago, they were telling us it was going to cost us $500,000 to get started.
Correct.
So we just said, "Oh well, thank you," and walked away. Uh, like that was in the Bible. From that day forward, many looked at Jesus and walked away. That's all we could do because we didn't have 500,000 just to get started, plus the millions that it was going to take to maintain it. But now, by the grace of God, He's given us the opportunity to build what we need for ourselves. So Lauren is about to show you the platform that was built from ground zero and has morphed into what it is today for the first iteration of the pilot.
So the first one that I did share with, and Brian know we was on with a high dollar funder. That one was geared to be a little bit more clinical. So I did remove all those caveats from the CareBridge that I did today for IWI. So you don't have to worry about any clinical, any names, any identifiers. Now, when we take this to another extreme, it will be HIPAA and 42 CFR protected when and if we get the funding to back this for them to put client information in. But as it stands right now, you do not have to worry about that at all. So you can pull it up on your phone. So if you are at an event, you can pull your CareBridge up on your phone, put information in. You can have it on your tablet, on your laptop. So first you see here is your mission control. That is the central command center that just will show you as the user your referrals. It will show you community signals, any service gaps. So how I have this set up, it will be set up as churches So it won't be like Miss Julie will, if be by herself. If she has 3 or 4 workers in her church, they all will have access. So they all will be putting data in, and maybe Miss Julie at the high level will get, when I get down to the bottom, she will see the community intelligence and the systems intelligence. But the very first level is the level that you will be functioning in as a user of this platform. So the mission control at the high level, you see, you have your participants, your referrals. It's just giving you at a high glance what you have put into the system. And so, for example, what I have in here, the person that actually used this system is finding out that Section 8 wait lists across Randolph and Howard County exceeds 12 months. Increasing number of encounters involving co-occurring substance and mental health crisis is at a critical high in Sheraton, in Randolph and Howard County. So that's how you can just look at a glance at your mission control. Your Beacon AI Navigator, it is a AI chat assistance for frontline individuals, for CHWs, for pastors, for community advocates, for our community, whoever would like to use it. It is a AI chat assistant. You can ask about patterns, gaps, and resources. All you have to do is come in and type whatever you want to type. What is a trend you seeing? You can just type whatever you want to. A trend you're seeing in Boonville, Missouri. A trend in Boonville, Missouri. Whatever you put in here, it will tell you. It is a chat bot. It will give you the patterns, gaps, resources, and recommendations. All you have to do is type whatever question you have right here in your AI Navigator. Participants. These are de-identified community members. So you see there is absolutely no names. So for each hub that is interested, it's say Libron or say Second Baptist Boonville. If they want to do SBB test 1, SBB test 2, we do not need individuals' names. And so that is something that I will work with you on the back end when I train you in more intensely, which is not going to take a lot of training at all, on how to put in participants. No names, nothing. All we're asking is for the county and their age. County and their age. Okay? And it has here, never enter PHI, Social Security, Medicaid, diagnosis. Names, addresses, phone numbers, and email addresses are hidden from standard pilot users. You are considered standard pilot users. In the other platform, that information is here. But that's when it is behind a HIPAA CFR 24 frame. But for now, we just need high-level information that a person's a veteran. They re-entering into the community. Your encounter screen is a log. It logs every frontline interaction with AI-assisted clinical notes. So you log an encounter, you click log. This is where I would put, if I go to Timmons Temple, I'm going to be TT client 2, and it could be a phone call or a community outreach, a group session, a follow-up, because they may needed a food box, and I will answer some of these high-level encounters. And as soon as you save that encounter, it will show up. It will show up on the log. It will show up right here. I kept putting reminders, do not put protected information. Crisis support. Because Brian and I have been working on not really necessarily a platform, but a curriculum. And this curriculum we're working on for our churches And this is going to be coming out later on. So why not get started now? A lot of our communities is seeing high substance, high mental health, people returning from incarceration. And so they're coming to your churches in crisis. And if that happens, you can come right here to crisis support. Type any question you need right here into this AI and it will help you. It will tell you, give you some motivational interview, and it will give you some trauma informed. If someone's in an emergency, the numbers are right here. So that's all crisis support is about. It will give you help if someone is in crisis. Reentry planning, I'm keeping it in here because we do a lot with individuals leaving jail. I don't know about your churches. Sometimes our churches get a call that a young lady is walking from Huntsville. She just got released from jail. She's homeless, or she doesn't have her IDs to help her get a job. All this reentry planning is, you may never use it in your church if you don't work with that population of people, but I chose to leave it in here. All you have to do is, if you're working with that person, you don't have to put their name. You can put what it's about, because we need the overall information. And maybe you referred them to a place that is hiring individuals that just got released from incarceration or released from jail. Or the church gave them $25 to pay for their Missouri ID. Whatever. That's the reason why I left that in there. Now, documentation, these are just the different, might be more clinical involved, but if you choose to write a note on someone or help write a care plan on someone or do a referral letter, you referring someone to a food bank or whatever, you can come in and this documentation will assist you. You can just write 3 or 4 words and the AI will generate it for you. No questions asked, and it will automatically generate that for you. Now, the resource one. The reason why the resource one is extremely important, because it also is attached to Kumu mapping. And AI knows resources in whatever county, whatever town you're in. All you have to do is ask where you're at and that you're looking for something. Or you can click on Kumu and it will automatically come right over here to Kumu mapping. And if you hit you're in Adair County, click on if you need child care services in Adair County, if someone needs a dental or they need pharmacy or eye care, food, and all you have to do is change the county. Up here where this blue is flashing, you come up here and it's a drop down box, and you can change the county to whatever county you may be in. So it's automatically connected to Kumu mapping. But besides being connected to Kumu mapping, the AI will look for resources for you as well. So I just did that top level for now. I will explain level 2 and level 3 in just a minute, but I don't want to get too far. Is there any questions? Tonight is at a high level. I will get deep down and explain it a lot better if, to the churches that are saying yes to be a pilot.
I think we just about got every just said yes, which is great.
Yes, because yes, I'm loving that.
Yeah,
I just thought I thought 3 or 5 I wouldn't scare away, but I'm happy. My heart is very, very happy.
Yeah.
Okay, so community signal. Now that's when we start looking at patterns. That's the reason why the top part is so important. So I don't care if you got a youth that is willing to help you. If someone is willing to help put information in this system so we can get the data, so we can possibly tell that funder, hey, this is the pattern we're seeing in Cooper County. This is the pattern we're seeing in Howard County. The manyest people you got working in this area, number one, then the person that is going to be in charge of coming and looking at their community signals, that's in level 2. Community signals flag systemic barriers and emergent issues that are spotted across these encounters. It does it in the system for you. So it will automatically tell you, hey, we got 5, we done have 5 encounters up here. We got 5. 1 is really critical, 1 is high. There's 3 system barriers, and 5 is new. And then that's when you can come in to the community signals and start seeing what is high, what is critical, what is moderate, and what is low. So right now, low in this county, faith-based reentry mentorship, showing 80% employment placement rate. So that's why it's flagged low. But once again, your critical is your substance, your housing, your food pantry usage. Food pantry usage up 40% across Mobley Hub, consistent with SNAP benefit reduction. So it will give you that high overview. Pattern recognition. Pattern recognition identify recurring community level trends from frontline data. So if that doesn't make sense to you, no big deal. It's something similar to the community signals, but it will, when I hit run pattern, or not necessarily me, but say Pastor Carl has 5 or 6 of his members that is putting information in, and he wants to come and hit run pattern analysis. He can literally go to his city council and say, hey, this is what we're seeing in our community. This is how important this can be to your hub. Because you will have the data. Now you will have the data. So that's what run pattern analysis. If I hit run pattern analysis, it will run it for you and show you. Trend monitoring does the exact same thing. It will let you know your emergent issues, your failures, your successes. It will give you your top unmet needs. Referral tracking is end-to-end referral pathway management with success rate tracking. So what do I mean by that? Now, this, in the long run, once we go another 2 or 3 levels higher, it's almost like what our CCMO, our community, our EHR does for us now. So say Pastor Carl in Boonville, because at one time we had the food bank in Boonville in our CCMO. He has a couple of individuals at his church that he wants to send a referral to the food bank. He can come in here and track that and see, did they make it to the food bank? Did, is it pending? Did they accept the referral? So we got a way that the food bank can get in as well and say, hey, yes, they showed up at Central Missouri Food Bank. Thank you for that referral. And it was connected and it was successful. So that is just another level that has been embedded into this system. Any questions? All right. System insight. This is level 3, and I'll try to hurry this up because I know I got 10 minutes. System insight. This is where we're going to be showing the funders. That $1 million funder that we talked to a couple of days ago. This is the level we're going to be showing them. At this level, system insight, it will give you the root cause analysis of any systemic issue driving community needs in 1 and 2. It will break it down and give you the analysis of what the root cause is. And just knowing, and I know Brian can second this, what we're hearing from every funder, they are wanting, almost every funder we've been here lately, they're wanting to know root cause information. They are done just funding programs. They wanting to know the impact of programs and root causes. So that's the reason why this was embedded in here. County intelligence. When you go to county intelligence, I have already put some county intelligence out here. So say, let's see, Pike County. I think that's over in Bowling Green. If once Pastor Wright's individuals start using this, yes, there's already data that AI is pulling from hundreds of databases about Pike County, Missouri. However, it will also combine what has been put in CareBridge. And say Pastor Wright wants to go and talk to his city council because in his black community, he's seeing something that they don't think is happening. But now he's got data. All he has to do is come in here and hit generate full intelligence brief. It will spin and it will give him a full intelligent brief. Pike County faces significant health access challenges despite a strong community network. Top signals: healthcare accessibility, economic stability with a poverty rate of 15.2% and unemployment rate of 3.5%. So it will give him an intelligence brief that he can save, email to his county officials, take it in hand. Existing church outreach, strong engagement through church-based programs provide resources and community support. So there is some strengths. Pike County Memorial Hospital is a strength. So right now, these intelligence brief is looking at probably 100 plus databases and pulling all the information they got on Pike County, Missouri. But then when it starts pulling what you all have put in, it will be an even stronger intelligence brief. Cooper County, Howard, I got them all in here. Pemscott, New Madrid County. I make sure I try to cover as many counties as possible, but all you all have to do is say, hey, Lorna, it's missing my county, because I know St. Joe has 2 counties, so it lets you know it's already in here. Alrighty, I got one more, and then I'll let you all go. Well, a couple more. Coalition action. A lot of the funders we know are asking about coalitions. So I put this in here. It's just cross sector collaboration tracking. It may be something that you may not even use, but just know when I am able to train you all on this, you can just come in here and add an action. Pastor Wright will add Northeast Community Action and put some information in about his coalition. So that is a high level, because what we're hearing, funders are wanting to fund coalitions, making sure that there's multiple people working on something. So that's why I put that there. And then I'm going to move down here to foundation dashboard. This is a policy dashboard. It generates impact summary, gap analysis, and policy briefs for funders. All I have to do, because there's no report in there yet, but once I got more data in here, I hit generate report. It will let the funder know the gap analysis, what policies may need to be worked on, and it will generate an impact summary. Now, the last 2 that's in here, and it's what I'm pretty proud of, is the workforce. And this doesn't even have tip of the iceberg of what Brian and I have been working on. Different platforms, different classes we have been working on. This is here for anyone to come in at any given time. Even though it says required, you don't have to do it. But it will give you a walkthrough, if you click on it, of how to use CareBridge. But other things, if you keep hearing about trauma informed, we're getting people coming in our church doors with mental health problems and substance problems, and I keep hearing people saying stuff about trauma informed. All you have to do is come here and click on trauma informed, and it will give you a module on trauma informed. It will give you a module on crisis intervention in the field. What does reentry support navigation look like? It will give you a 50-minute module on what reentry support navigation look like. And please, always come in and do the self-care and burnout, because I don't want anyone to to burn out and make sure you do self-care. And the reason why, that's my last one, workforce wellness. It's just a daily check-in for the person that might be using this, because I don't want anyone to burn out. How you feeling today? If you want to come in and type something to yourself and submit it, it will keep track. CareBridge will let me know, Lorna, hey, you had a 10 out of 10. You need to, whatever your self-care is, listen to jazz, drink some wine, whatever. That's what you need to do. I just said that for my brother Brian because I know he does not indulge. I just said that. All right. I am done. I will stop sharing. Hopefully I didn't lose anyone. And now since I'm stopping